Hi, my name is Patricia. Welcome back to the channel. You can find me at lifeandmed.com. Like I said, my name is Patricia. I'm a registered nurse and a Medicare agent. You can also reach me at this number right here. So in this video, we're going to talk about the 5 different types of Medicare Advantage plans. So we're going to go over HMO plans, PPO plans, special needs plans, chronic condition plans, last but not least, private for fee service plans. So if you want to know, keep watching this video. First, we're going to start with HMO plans, which is Health Maintenance Organization. Now, an HMO plan is a Medicare Advantage plan where you do need to stay in a network. What does that mean? So you have healthcare providers, doctors, therapists, hospitals that are within a particular network. And to receive care, you do have to get care from those healthcare providers within that network. Now, what if you need to see a specialist? Now, with an HMO, you do need a referral from your primary care physician to see a specialist. So a referral is required with a HMO plan. Now, what if you want to see a doctor in an emergency situation, say you're out of state? So you can see physicians and healthcare providers outside of the plan network if it is an emergency situation, such as ER visits, urgent care, and out of service area for dialysis and an emergency situation. It's also important to take note that most Medicare Advantage plans that are HMO do cover prescription drugs as well. So that is pretty much what a HMO plan is. Now let's talk about PPO plans. All right, so let's talk about a PPO plan. A PPO plan is a preferred provider organization. Now say that 3 times fast. All right, so what is a PPO plan? A PPO plan is a type of Medicare Advantage plan where a referral is not needed. With a PPO plan, a primary care physician is not required. You don't also need a referral to see a specialist as well. So if you want to go ahead and see a specialist and that specialist is taking new patients, you can go ahead and make an appointment. A referral is not necessary. Now with a PPO plan, you can see doctors outside of that plan's network, usually at a higher cost, but it's nice to know that you do have more choices when it comes to seeing doctors outside of the plan's network. So why do many clients choose a HMO versus a PPO? Well, even though the PPO provides a larger network of doctors, the HMO plans provides more benefits. So it just depends on what's your preference. Would you like more benefits such as dental, vision, and hearing, or would you prefer more doctors in your network? Also with a HMO plan, the out-of-pocket cost is generally a lot lower than a PPO plan because the HMO plan have a more restricted when it comes to networks. So both plans are great. It just depends on your particular healthcare need. Another type of a Medicare Advantage plans are the giveback plans. Have you seen the Medicare Advantage commercials that claim they would give up to $170 back into your Social Security check? Well, you should proceed with caution because these giveback plans do have a higher cost sharing cost. So what does that mean? So 9 times out of 10, when you actually use the plan, it will cost a lot more than a regular HMO or PPO plan. So it's very important to make sure you compare the plan with the plan that you already have. For an example, you may have a regular HMO plan to see a specialist maybe $5, but this give back plan may be $15 or $20 to see that same specialist. Your labs, your x-rays, MRIs, etc., those services will also cost a lot more on a give back plan. Now, the big kicker that you really want to pay attention to is the inpatient hospital visits. A lot of times, these give back plans, inpatient hospital visits are triple of the regular plans, so you want to be careful if you are not a healthy individual and you see the doctor quite often, or you have hospital stays once or twice a year. I definitely do not recommend that you get on a give back plan, because at the end of the day, it will cost you a lot more to use a give back plan versus a HMO Medicare Advantage plan. So it's very important to take caution when you consider a give back plan, because are you really saving in the long run? So if you are a very healthy individual, maybe a give back plan would be just fine for you. But like I said, if you're not, then I would definitely proceed with caution when it comes to a give back plan. The extra $100 a month back into your Social Security check may not be worth it. Even in these commercials, these celebrities are claiming they're getting up to $170 back into their Social Security check. I think not. So another plan is a S&P plans, which stands for Special Needs Plans. These plans are geared for certain diseases such as COPD or diabetes. Now, since these plans are geared for certain diseases, prescription drugs must be included to help with certain medications an individual needs to take and treatments. So these plans, like I said, are geared for individuals with certain diseases. Some of these plans will cover out-of-network doctors, and most of these plans do require a referral to see a specialist. Another plan that falls under the category of a S&P plan is a D-SNP plan or a D-SNP plan. A D-SNP plan is for individuals that are dual enrolled in both Medicare and Medicaid. These individuals tend to get more benefits than the regular plans, such as a monthly grocery card. Now, with these plans, like I said, you have to have both Medicare and Medicaid, and Medicaid will pay for the Part B premium as well. So those plans, like I said, our individuals are dually enrolled in both Medicare and Medicaid. If you want to know how to enroll in both, I already made a video on that, and I will leave that video at the end of this video so that way you could go ahead and watch that video. Alright, so let's talk about C-SNP. Very similar with these special needs plans, but these are individuals with chronic conditions. These are called C-SNP or the chronic condition plans. Now, these are individuals, like its name, with chronic conditions such as heart failure, diabetes, HIV and AIDS, dementia, and end-stage renal disease. It acts very similar to the S&P plan, but they're geared for individuals with chronic conditions. Now, the last type of plan that we're going to discuss in this video when it comes to Medicare Advantage Plans are PFFS, Private Fee for Service. Now, with this particular plan, you could go to any approved Medicare doctor, other healthcare providers, and hospitals that accepts the plan's payment terms. With a private fee-for-service plan, you are in a network of doctors like an HMO. Now, you do not need a primary care physician. You also do not need a referral to see a specialist. Also, a lot of these plans may or may not cover prescription drug plans. The plan decides how much you would pay for cost sharing. The cost sharing list would be located in the annual notice of change and your evidence of coverage. So that way you know how much you are required to pay for doctor visits, copays, and such. Thank you so much for watching this video. If you learned something today in this video, please give this video a like, Comment if you would like to as well. And please subscribe to this channel and share this video with a friend. Thank you so much for watching. Like I said, you can find me at lifeandmed.com, and you can find me at this number right here. Thank you so much for watching, and I will see you, yes you, on the next video.